Welcome to Med-Surg Tutor, and in this video, we'll be talking about pressure injuries. So what is a pressure injury? Well, a pressure injury is basically a wound caused by prolonged pressure on the skin. So what happens is blood flow is cut off, which leads to skin breakdown. And the common areas this happens is bony prominences such as the heels, the sacrum or lower back, elbows, hips. Just think about if your patient is laying down all day or they're bedridden. All that pressure from the weight of their body on those bony prominences is going to lead to decreased blood flow, which is ultimately going to cause skin breakdown. Pressure injuries also are known by bed sores, pressure ulcers, decubitus ulcers. These are all the same things. A little NCLEX tip here is pressure plus time equals tissue damage. So all that pressure from laying down in the bed over a long period of time is going to cut that blood flow off, leading to what? Tissue damage. Some of the risk factors for pressure injuries include a patient that can't really move well. So think about a patient that's paralyzed or bedbound or weak. They're not really moving that much. So for one, that blood flow isn't really being stimulated. And for two, all that weight on their bony prominences is going to stop that blood flow. So these patients are high risk. Poor nutrition. So let's think about our patients who are not really getting adequate nutrition, not getting the proteins, vitamins, they're not really staying hydrated. This impacts their ability for wound healing and their skin breaks down more easily. What else? We have patients with too much moisture. So think about those patients who are incontinent. Patients who are sweating, peeing, there's stool on the skin, maybe they're not getting clean properly. All of this moisture irritates and weakens the skin, causing the risk for getting a pressure injury to increase. Rubbing or friction. So think about if you have to move a patient in bed. If you're dragging that patient across the bed, you want to be mindful of the friction and rubbing because this can cause tears. And once the tears happen, this is breaking the barrier of the skin, which can also increase the risk of having a pressure ulcer. And the NCLEX tip here is that we use the braiding scale to actually assess the risk of a patient to see their likelihood of getting a pressure injury. So all of these factors are very important to know. I highly recommend focus on those bedbound patients and the patients who have a lot of moisture. Some of the preventions for pressure injuries include repositioning your patient. So think about it. If you have a patient laying down in bed, all that weight is on those bony prominences. Well, think about it. What would you want to do? How will we get that weight off of those bony prominences? Well, we would want to reposition our client. So you'll see a lot of test questions that say every 2 hours in bed or every hour in a chair, just kind of like a range where you would want to keep your patient. You also want to keep that skin clean and dry. So remember the last slide for the risk is moisture. So one way to avoid that is by using barrier creams to prevent breakdown, getting rid of that moisture, and using pressure relief devices. So there's some special mattresses, cushions, and heel protectors that'll kind of help decrease the pressure on those bony prominences. And I want to emphasize good nutrition, proteins, vitamins, water. This all promotes faster healing, especially protein. So you guys might get a question that's asking what's the best meal to give a client that has a high Braden score rating. And you want to pick that meal that has an emphasis on high protein. That is really going to help them with faster healing. And most of all, you want to stay hydrated. We don't want our patient to have dry skin because that's going to increase the risk of them getting a pressure injury. So keep in mind repositioning often, making sure they're getting that protein and they're staying hydrated. NCLEX tip, turn, cushion, clean, hydrate, and nourish. Keep it simple. Some of the complications can be infection, slow healing, and pain. So infection is very important because this can turn into a life-threatening situation known as sepsis. So we really want to stay on top of pressure injuries with preventions. Slow healing. So you guys want to be mindful of your patients with chronic illnesses like diabetes, because these patients are more prone to slow wound healing or altered wound healing. I want to keep in mind that pressure injuries can also be very deep and painful. So as nurses, if they have any pain medication that is prescribed to them, we want to be sure that we're giving it. So we want to look for that redness, warmth, swelling, drainage. Just keep an eye out on those infection signs so we can implement all the prevention strategies to prevent it from the complications like sepsis, controlling things like pain, things of that nature. How to stage pressure injuries. So in this video, I do not have any pictures, but I want to pay attention to the keywords here that you'll see on exams. So a stage 1 pressure injury, this is when the skin is red, but however, the skin is still intact. So the skin is non-blanchable. That is the keyword you guys want to look for. Intact, non-blanchable skin. Stage 2 is a shallow open wound or blister. So here you'll see partial thickness. Stage 3 is a little bit deeper. So some fat may be visible, some slough may be visible. Here you'll see full thickness. Stage 4 is the deepest. You'll see bone, tendon, muscle. All of this can be exposed. And then we have unstageable. This is when the wound is covered with dead tissue, which is slaw or eschar. I like to look for the word eschar because this really shows you that this pressure injury is at an unstageable wound, which means that the depth is unknown. So guys, be mindful of these keywords because they're kind of going to guide you towards knowing what stage it is when it comes to answering those questions.